If part of your New Year's resolution is to stay healthy in 2019, then no doubt you realize that screenings and prevention is going to be part of that cure. Coming up on January 16th, CHI Memorial is having a free hernia screening, which might sound perhaps a bit unusual, but they've done it this past fall.
Yes.
So successful, they've brought it back just a couple of months later. Dr. Christina Parkhurst joins us this morning. Good to see you.
You too, thank you.
So we were chatting a little bit beforehand, and I had asked you, are hernias really all that common? And you said they can be.
They can be pretty common, yes.
So is it something that you are either genetically prone to, or is it a creation of, is it a cause of something?
There's not really a genetic component. It's typically a cause of something. There are sports hernias, which can be made larger with heavy lifting and heavy activities. Incisional hernias, after having surgery, you have the possibility of getting a hernia in the future. And then belly button hernias. Everybody is born with the belly button hernia. It typically goes away before age 5. But if it doesn't, it can get bigger as you get older.
So is a hernia, is it painful? How do you know you have one?
So sometimes they can be painful. Most people will notice a bulge or an area that's sticking out somewhere on the abdominal wall or in the groin. But the number one complaint is a burning sensation or a burning pain. And then as they get bigger, you run the risk of having a bowel obstruction, and so that can be a medical emergency.
Okay, so you're going to have this screening, and by the way, it is for the sports-related hernias and the abdominal ones.
Yes.
The hiatal hernia, which is a whole nother topic, you're not screening for those.
Correct. We can't do that in a community room at a hospital. That takes more of an involved exam, and so we wouldn't be able to do that.
Okay, so you mentioned in the community room of the hospital, which sounds like it's not a very invasive screening procedure.
No, we do.
How do you do it?
We do have curtains, and we'll go take you privately behind a curtain, and if we need to examine you, then we'll do that and make sure that you do or don't have a hernia, and if you do, then we may have you follow up, or we may even just go ahead and schedule you for surgery at that point.
Okay, so to the treatment options, is surgery the only way to address a hernia, or are there other things you can do?
Yeah, in most cases, surgery is the only way to fix a hernia. The hernia is not going to get better without surgery in adults. There's no way that it'll get better over time. So surgery is the only option. There are some patients that we would say, well, the risk outweigh the benefits, so let's not maybe do surgery at this point. We can watch and wait.
Okay, so for the weekend warriors out there who've turned that calendar to the new year and they want to get healthy, and maybe weightlifting is part of their new routine, do you have to be careful in the way you're lifting? Don't do too much too quickly.
Yeah, if you have a hernia, then you can make it much larger by doing heavy weightlifting. And so that may be something you want to address while it's smaller, get it fixed, recover, and then go into the gym. Once it heals up, you should be able to pretty much do whatever you want to do in the gym.
Okay, now you will not be the only doctor there that day, right?
There'll be 4 of us doing the hernia screens.
Okay, you've mentioned a couple of times in adults, you don't want to see it grow. Children can get hernias as well?
Yeah, so you can be born with a hernia. Like I said, everybody has a belly button hernia when they're born. That's from the umbilical cord, and that typically goes away before age 5. If it doesn't, then that's something that needs to probably be fixed. And then kids can also get inguinal hernias, which are congenital, and that's just part of our embryology.
Okay, if you, I mentioned the strain, so weightlifting you think of as being a way to cause it. If you are going to just go run and you don't stretch properly, can that cause a hernia?
Not typically. The stretching wouldn't really involve the abdominal musculature and things like that. It can affect groin hernias though, and so people who, like football players and things like that, that's why they do sports exams. They want to make sure you don't have a hernia because you can actually make that worse.
So once you're in, if you're a person who needs to undergo surgery, what does the surgery look like? Is it done robotically? Is it a big incision?
So there's lots of different ways to do the surgery, and it's very patient dependent and also surgeon dependent. We do have the Da Vinci robot, which is one of the better ways to do the hernia repair now. It's a minimally invasive hernia repair, and if you're a candidate for that, then it can get you back to work a lot faster. The robot is controlled by the surgeon. It's not artificial intelligence or anything like that. It's not going to do the surgery for us. It's just one of the tools that we use to do the surgery, and we can do big hernias through pretty small incisions typically.
You mentioned getting you back to work quickly, so this is not something to scoff at. It's a surgery.
Correct.
So the recovery time is what, a week or so?
If you can get it done minimally invasive, either laparoscopic or robotically, then getting back to work may be a week or 2 depending on your job. Getting back to full physical activity may take a few more weeks, but that's just because we don't want to make any other problems come about.
And since it is in your abdomen, that's your core, which is everything.
Correct.
So physical therapy plays a key part. Do you go to physical therapy
Not
afterwards?
typically. Normally people can gradually start doing their normal activities after the first 1 to 2 weeks.
Okay.
And then I just tell people to listen to their bodies. If your body's telling you it's too much, then you probably need to slow down and wait.
Okay, so if you are noticing something that you hadn't noticed before and you're concerned it might be a hernia, this is your chance to come and have a free screening. Maybe you know that you have one and you just want a second set of eyeballs looking at it. That's okay too.
Yep.
January 16th from 4:30 until 6:30. It is in the community rooms there at the Memorial Campus on in the downtown area. They would like you to RSVP simply so that they can know kind of how many people to watch for. You go to memorial.org/hernia screening to do that.
Yeah.
Thank you so much.
Thank you.